If you are a first-time parent, weaning your baby off milk to eating other food might involve plenty of research and reading. There are so many questions, rightfully so, but there are even more different answers from neighbors, self-acclaimed professional parents, wellness coaches, and online gurus, and many others. Everyone seems to have their own best way to wean. It is an important milestone for children to go through, indeed. So it is justifiable for you to look for information, to do it correctly, to be careful. But please make sure you get the right information from the right person. Hi healthy buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. And today we will talk about weaning. I decided to make this video because of some misinformation about weaning that is not only wrong but also can be dangerous for our babies. In this video, we will learn about baby-led weaning too. So, what is the recommended way to go about introducing our babies to solid food? Let's answer the question one by one. At what age should we start weaning our baby off milk? World Health Organization and pediatricians all over the world recommend parents to start weaning at about 6 months of age to satisfy the nutritional demands of developing infants. Delaying it can increase the risk of feeding difficulties in your child later on, in addition to the risk of not getting enough amount of nutrition. On the other hand, babies should not be weaned any earlier than 4 months of age because their bodily systems are generally not fully developed to process the food and convert them into nutrients. While breast milk or formula milk alone is enough to meet the nutritional needs of babies younger than 6 months old, some infants might need to be weaned earlier, either due to suboptimal growth or mineral deficiency, for example, iron, which could have other implications. But please note, this must be done only under pediatrician's guidance. That being said, I do not mean that all babies have to start getting solid food exactly at 6 months old. Your baby may be ready for solid food earlier or later, slightly earlier or later than other babies. Apart from age, you need to take cues from your baby to see whether your baby is ready for the first food or not. Generally speaking, a baby who is ready for solid food will show some of these following signs. First, your baby is able to sit steadily in an upright position, whether with or without support, and can hold the head up. It is easier to eat solid food in this upright position. Number two, your baby shows enthusiasm in food, like, for example, looking for your food when you are eating, or trying to snatch to take your food from you, and open his or her mouth when you offer food. And number three, your baby is able to chew and sift food from the front of the mouth to the back of the mouth to swallow it, rather than pushes it back to the chin. And four, baby stops sticking tongue out between upper and lower set of teeth when swallowing. In other words, your baby is able to swallow solid food and liquid differently. And your baby draws and brings objects to the mouth, objects of food into the mouth more often, and cries, asking for food before their usual feeding time. This can be a sign that they are hungry. Next, how to wean. Baby-led weaning or traditional weaning, which one is recommended? Babies are introduced to solid food gradually. First, it is in thin puree consistency, then thicker puree, then finely chopped solid, and so on and so forth, following their age and their readiness. The food offered to them gradually shifts towards family food. because we need spoon to eat puree, especially thin puree, and young babies have not developed the motor skill to use spoon yet, caregivers or parents play a major role in this weaning process to spoon the babies at the beginning. This is known as traditional weaning, as opposed to baby-led weaning. Baby-led weaning is an alternative method of baby feeding that promotes infant self-feeding, which differs from traditional parent spoon feeding. The key features of baby-led weaning are that babies eat together during family meal times, whereas in the traditional feeding, the parents or caregiver must feed the baby before or after the parents' mealtime. And the whole baby fist-sized pieces of food are offered to the babies. Babies will be feeding themselves from the beginning of the weaning process at around 6 months of age. Although parents offer food, the baby controls the weaning process. That is why it is called baby-led weaning. In that process, the baby decides what to eat, how much, and how quickly to eat. The key difference literally lies in the who leads the weaning process. The baby in the baby-led weaning versus the parent or caregiver in the traditional weaning. Currently, there is not enough evidence to confirm that baby-led weaning is able to provide infants with sufficient nutrition compared to traditional weaning. On the contrary, some studies had observed that some babies on baby-led weaning ended up taking more milk and less solid food as compared to babies on traditional weaning, which could lead to lack of nutrition for the baby, especially iron. Other studies also indicated that some mothers prioritize ease of feeding over nutritional recommendations. They prefer food that are easy to prepare and preferred by the baby that can make their baby happier, which could also result in inadequate nutrition for the baby. In addition to malnutrition risk, my personal concern with baby-led weaning is choking hazards. I've seen too many cases involving food blocking young children's airways. Some patients were safe, some were not so lucky, but all of them fed themselves. Healthy infants over 6 months of age are developmentally able to self-feed. However, strong chewing skill in some children may not be fully developed until 9 months. These young babies need specially prepared food so they can swallow safely despite their immature chewing ability. In other words, please always start with thin puree and progress accordingly. It is to minimize choking risk for your baby's safety. If you still want to implement baby-led weaning, despite all I mentioned just now, please inform and discuss with your family pediatrician about this approach. Your baby growth parameters like the weight and height, especially during the first few months of baby-led weaning, need to be monitored and evaluated closely. So supplementation can be given in time when necessary. Because babies in baby-led weaning are in higher risk compared to the traditional weaning. Because babies in baby-led weaning have higher risk of iron deficiency, please include high iron food like small pieces of red meat. I repeat, small pieces. You also need to introduce a variety of food in gradual manner to include a broader variety of textures, colors, and shapes too. So, not fully decided by your baby. Because baby-led weaning does not mean your baby only eat things that he or she likes to eat. And please avoid hard food, especially the small and round food like nuts or grapes or cherry tomatoes to minimize the risk of choking. And never ever leave young children alone with food. After talking about when and how, let's talk about what to eat. Iron-fortified cereal is popular first weaning food, which tends to be preferred by many children because the taste is nice and usually we add milk to it. It is rich in iron, just like spinach and red meat, which is very important for your baby development. Your baby can start off with having it once a day for a few days, then increasing it to twice or 3 times a day gradually. While some parents like it because it is very easy to prepare, others see it as a kind of ultra-processed food for exactly the same reason. The good news is we can always make our own puree. You can make your own pureed pumpkin, a yellow pumpkin, which is naturally sweet and delicious. It is rich in beta-carotene and many other important nutrients. You can also make pureed spinach, which is high in iron content and fiber to promote good bowel movement. Pureed carrots and papayas, both are rich in carotene and fiber too. Or pureed bananas, which is loved by the old wives and babies alike. Pureed potatoes, tofu, corns, meat, and many others. All these baby first foods should be fully cooked first until they are soft enough. I personally prefer steaming over boiling or baking. The food must be soft enough to be pureed into a consistency that is slightly thicker than milk. If you steam or boil the food, you can use the water to make the puree thinner or just add milk. For the first food, the puree must be smooth and easy to swallow. If the food retains the shape on the spoon, it means the food is not thin enough. You need to add more liquid. You need to remove all fat, skin, and bones from chicken, meat, or fish before cooking. Similarly, remove all seeds or hard bits from fruits, if any, before puree them. Remember to avoid any form of seasoning at the beginning. Do not add sugar, salt, or any other additives. Other food to be avoided are honey, cow's milk, or fortified dairy alternatives. They are not recommended until your baby is older than 12 months. Introduce one single food at a time and wait for about 3 to 5 days before introducing another new food. So it is easier for you to identify food allergy or intolerance. And stop giving the new food to your baby if any undesirable reactions to the food happen. For example, your baby is vomiting, diarrhea, or etc. Note it down and check with your doctor before trying it again. And remember, it is better to be safe than sorry. The proportion of milk to solids will depend on your baby's age and their development. The consistency of the food being introduced will also change accordingly. For 6 months old baby, at the start of the weaning process, you can exchange one milk time with solid food. Once your baby is used to solid food, then you can slowly increase the number of solid feeds to twice a day. At this age, milk is still your child's main source of nutrition, and the total amount of milk should not be less than 100 milliliter per kilogram of the baby weight per day. For a 7 to 9 months old baby, your baby can have up to 2 or 3 solid food per day. Thus, the milk feed can be cut down by 2 or 3 feeds if your baby is eating solid food well. The food consistency can be thicker, so your baby can start to learn chewing. Please pay attention to your baby's readiness to step up on the solid food. So you can try to give finger food when your baby is ready to further develop the chewing function and encourage your baby to learn how to feed themselves. But again, never ever leave your baby with food or any item small enough to be inserted to their mouth. And for 9 months old and above, baby usually can have about 3 meals per day. Thus, the milk feed can be cut down by 3 feeds if the baby is eating solid food well. The food does not need to be in pureed states anymore. You can try to give your baby finely chopped or minced food. Chop it into fine pieces. And then when your baby turns 1, you can allow him or her to eat what the rest of the family eats. Don't need to prepare the food separately anymore. But again, it depends on each baby's readiness. That is my sharing today about weaning food. It is important to make mealtime happy and stress-free indeed. But food safety is as important, if not more important, than that. Choking hazard is real. And please do not take it lightly just because you have never experienced or seen such case. I hope you found this information helpful and can be a blessing. If you like this kind of evidence-based health information, please like and subscribe. If you have any health-related questions or topics you want me to cover in my future videos, please type it in the comment. But please do not consult your personal health issues here. That must be done personally with your doctors. And this is my disclaimer. Thank you for watching and see you in the next video. Stay healthy and happy.